Lutetium-177 dotatate. This video is prepared for the patients dealing with Lutetium-177 dotatate radiopharmaceutical. Lutetium-177 dotatate is mainly used for patients with end-stage prostate cancer taking up gallium-68 labeled dotatate on their SPECT. Lutetium-177 dotatate is used for treating the patients with neuroendocrine tumors. It is the first specified treatment for this indication. It is used in adult patients with cancer whose somatostatin receptor positive. Lutetium-177 dotatate binds to somatostatin receptors to deliver radiation directly into the tumor cells. Lutetium-177 dotatate is a therapeutic agent that is formulated as a sterile, non-pyrogenic, clear, and colorless isotonic solution of Lutetium-177 dotatate for intravenous injection. Lutetium-177 dotatate is provided as frozen in a lead-shielded container. This container is in a bucket containing a package filled with dry ice and tightly fixed with a clamp. There are two labels around and on the top of the bucket that give corresponding information. When you open the bucket and remove the first packaging part of the bucket, dry ice and the container could be observed. Please check the label on the container with two other labels around and on the top of the bucket. Bring it behind the lead shield and cut the banderole of the container. The manufactured product in a single dose has a total activity of 200 millicurie of Lutetium-177 and a volume of 10 milliliters. In a multi-dose version, its activity is a factor of 200 millicurie when calibrated. Keep it in a freezer of -10 degrees to -20 degrees centigrade, 14 degrees to -4 degrees Fahrenheit in a lead shield container. Storage and delivery of the Lutetium-177 dotatate radionuclide from governmental offices by an authorized person should be appropriately controlled in an appropriate manner. The 15 milliliters glass vial is placed in a lead shield. The drug product expires 7 days after production date noted on the label. After thawing, do not freeze it again. Place the product behind the lead shield in the room temperature before the injection. The injection solution must be visually inspected before use. It should clearly contain no other particles. The operators should be careful of their eyes against radiation while inspecting the solution for clarity. Thus, the operators have to run these steps behind the lead shield. The activity should be measured by a dose calibrator immediately before consumption. Any unused medicinal product or waste material should be disposed in accordance with protective requirements. All of the foregoing steps for using the product must be conducted with extra caution. If there is any question about the product, please contact Parse Isotope Company.